So those are my 5 tips. Wow, that was definitely 10, Lauren. Hey everyone, it's me, Lauren from Speak from the Heart, where I give you all things speech, language, and life. I am a licensed and certified speech language pathologist, and I'm so happy that you are here watching my newest video. I know it's been a while, and in light of everything going on in the world right now, I just hope everyone's being safe and, taking measures to stay healthy. You, your families, your patients, everyone. Just really make sure you're taking care of yourself. That is super important right now. I wanted to make a video because obviously when we treat patients, because some of us are still working, some of you may be doing teletherapy, but before we can provide effective treatment, we have to conduct an effective evaluation. So we have to figure out what is the problem and how are we going to fix or treat this problem with our patient. So I am giving you today 5 tips to conduct the most effective evaluation possible. These are all things that I use personally in my practice, and I hope they are super helpful. So let's get started. Number 1, to make sure you obtain a thorough case history on every patient, every client, every child, whoever you're working with. Case history is comprised of lots of different information. So case history can include other medical issues. It can include, if it's a child, what the child does in their free time. Is the child in school? How does the child interact with other children? How does the child act with the parents? If it's an adult client, it may be things like what the adult client was doing prior to the accident or prior to the stroke. It may include in their words, what's going on. And when I talk about medical history or pertinent medical issues, it's not just what happened as far as like a stroke or a traumatic brain injury. It's things that may have happened 10 years ago or 20 years ago, because those things can also impact what may be going on currently. So you need to make sure you dig deep, ask lots of questions. And when people come in to see me for an evaluation, I always tell them, this will feel like I'm interrogating you, but I promise it's just to make sure that you're getting everything you need from me. For patients who are coming to see you for dysphagia, asking them what diet are they on currently? Have they ever had a modified diet? Have they had an MDS or a FEES before in the past? It's just everything that you can think of. And sometimes you will need to request different documents from different doctors. So maybe a patient has had a modified barium swallow, or they've seen an ENT and had a laryngoscopy. You want to make sure that you have all of that so you know exactly what you're dealing with. Number 2 is to use both formal and informal measures. So formal measures would be things like standardized assessments such as the Western Aphasia Battery, the Goldman-Fristow, the OWLS, the Alpha, the RIPA. I mean, there's so many out there for different diagnoses. But the thing is, there's only so much that you can test for with a standardized assessment. They are very structured. They're tasks that are really not reflective of a daily communicative task or a daily communicative scenario. So what I use in outpatient rehab, I use a compilation of standardized assessments. So there's some assessments from the Western Aphasia Battery, there's some from the RIPA, there's some from the CLQT, and there's one more. Oh, some from the Boston Diagnostics. So it's just this huge form filled with these subtests, but I'm able to fully and comprehensively assess the patient using this compilation of subtests from standardized assessments. The other part of that too is not only relying on what you're obtaining from testing, but also what you're seeing during the assessment. So I know sometimes I'll ask my patients, how are things going at home? What are you wanting to work on? And they'll tell me, like, I want to be more independent with medication, or I want to be able to have a phone conversation. And I'll be like, okay, well, I'll go out into the main office. You call me, let's see how you do on a phone conversation. So I try to listen to what they want and have them do that during the evaluation, and that way I can see exactly where they are. So you're using different measures to collect the information that you need. My 3rd tip, oh my goodness, this one's so important, and you always need to obtain patient permission before you do this, is to audio record your evaluations from start to finish. I would even recommend having it when you go and get the patient or the client out of the waiting room, because that's when you start your evaluation. Like, I know as soon as I go out and I call the name, Mr. Smith, Mr. Jones, whoever it is, that's when I start my evaluation. What happens is because sometimes you miss things. You're writing things down, you're trying to remember what the patient said, what the caregiver said. Just have an audio recorder on the table while you're conducting your evaluation, and you can always go back and listen if you need to, if you felt like you missed something or you want to include something in your report that the patient said verbatim. Audio records, you can buy audio recorders from Amazon, Walmart. It doesn't have to be like excellent quality. I have one at work. I don't remember what brand it is, but I've had that thing since grad school. So it's, you know, it's pretty good. It's pretty good, but that's definitely an important tip as well. My fourth tip for an effective evaluation, because we get so caught up in what we want to write as goals, you need to ask the patient, what are your goals? What do you want to achieve? What do you want to improve on? Because it's not just what we see as a goal, it's also what the patient sees as a personal goal. So always include that question in your evaluations. Mrs. Smith, what do you want to work on? What is your overall goal? It will make a world of difference in your treatment too, because the patient will be motivated to work towards those personal goals. So always make sure you ask that. That is super, super important. And then my fifth goal, and this one's very important as well, is to assess stimulability. And what I mean by that is, let's say, and I'm just gonna use an adult example because that's what I do all the time. Maybe you have a patient who goes through the object naming portion of the Western aphasia battery, and they are unable to name any of the objects. But what I do is I assess for stimulability. Are they stimulable to produce the name of this item using a phonemic cue or a gestural cue? Or, you know, what kind of cue will get this person to be able to name this object? I use that information for me for therapy as well, and I include that in my report. So patient unable to name 10 out of 10 items, but with a initial phonemic cue, patient able to name 5 out of 10 or whatever it is. Same thing with pediatrics. Maybe you have a child who is unable to produce S's, initial S's. But also see if they are stimulable to produce that sound in isolation. So that way you can report unable to produce initial S or S in multiple word positions, although patient stimulable for isolated S with visual cues or phonemic cues. So always do that at the date of evaluation, because that will help drive your therapy as well, and it gives you more information for your report. Those are my 5 tips for an effective evaluation. I hope this was really helpful. As always, please let me know if you have any questions. Make sure you like this video, subscribe to my channel, and I will see you in the next one. Bye.